Hey everyone, my name is Jenna and I'm a counselor at App State's Counseling Center. And I want to thank you for joining me today for Anxiety Toolbox, the series, part 2, Challenging Unhelpful Thinking Styles. And so since this is part 2 out of 3, if you have not seen part 1 yet, or were not able to join our live workshop for that, please pause this, go back, watch the first one, because we will be building off of some of the skills and concepts that we learned in session 1. So that's a really important one to watch. But if you've already seen that and we're ready to get started, let's go. So quickly before we get started, I do want to make sure that we're all on the same page here. This Anxiety Toolbox and other quick access virtual workshops provided through App State are intended as psychoeducational in nature only and not designed to provide a mental health treatment or emergency response. We really encourage you to visit our website, counseling.appstate.edu, or give us a call if you're within the Boone area to learn more about mental health treatment options. And if you are experiencing a mental health emergency, please visit our website to read more about emergency resources. So today what we'll be discussing, we'll be exploring unhelpful thinking styles, as the title suggests, and then importantly discussing how to challenge those unhelpful thoughts or how to manage them. We'll then continue our talk about mindfulness and practicing some mindfulness techniques, explain what cognitive diffusion is and how it can help us manage those unhelpful thinking styles, and then practicing some important grounding techniques and talking about progressive muscle relaxation. So some really great information and some great practical skills we can use by the end of this session. So first off, what are unhelpful thinking patterns? And likely, if you're human, you've probably experienced some of these at some point in your life to some degree. So we have this list, this common list, because that's what they are. They're common. At some point or another, we've all probably thought in similar ways. And so that's to kind of normalize this experience of we do sometimes think thoughts that aren't super helpful. And there's a lot of, can feel a lot of power in recognizing that and naming those types of thoughts when they come up. So we'll go through a number of them here. And as I go through this list, think for yourself, how does this apply to me? When have I experienced these thoughts before? So this first one, all or none thinking. So either I do something completely right or not at all, or everybody likes me or nobody likes me. Sometimes we can put that those qualifiers on some of our thoughts of if, my best friend doesn't like me or my best friend didn't text me back, then that must mean, she hates me now. And so we can really see this kind of black or white, all or none sort of thinking style. This next one, overgeneralizing. So thinking kind of nothing good ever happens. Even if we do have a group of friends, our mind kind of tells us, nope, you don't have any friends, nothing good ever happens, you're going to fail all these tests, and it's, ooh, ouch, kind of hurts. So this mental filter and disqualifying the positive. So we only pay attention to certain types of evidence, and often those types of evidence validate that feeling that maybe we're not good enough, or those unhelpful thinking patterns are right. And so this might be if we get a good grade on one quiz, but then haven't done well on other quizzes, maybe we think, well, that good grade was just a fluke. I'm not really that smart. That was just a mistake. And so we're only paying attention to those things that validate our own feelings of maybe that we're not as smart or that we're not worth as much. And so making sure we're identifying what those kind of positives or those challenges, which we'll talk about in a little bit. And as I go through this, you might notice that some of these kind of blend into each other. And so this isn't, one thought can kind of encompass a number of different patterns. And so just kind of keeping that in mind as we go through. So this next one, jumping to conclusions. This is generally a fan favorite. People do this a lot, of thinking that we can mind read or that we can kind of tell the future. So this might look something like if maybe you're kind of nervous about meeting a new group of people and you tell yourself, oh, well, they don't like me, or I know that they think I'm weird, when we haven't gotten any evidence to back that up. These people we just met, but we tell ourselves, no, they must hate me, or they must think I'm really awkward. And so we feel like we're reading their minds. Or we're going to meet a group of new people and we tell ourselves, well, they're not going to like me. I'm not going to go because they're just going to think I'm weird. We can tell the future, which, as we know, we don't do a very good job of that. And so understanding when we think we're putting words or putting thoughts in other people's minds, or we're predicting a future that may or may not happen. So some other types of unhelpful thinking patterns. So catastrophizing and or minimizing. So catastrophizing we kind of see as the snowball effect. So blowing things out of proportion. If I get a bad grade on one quiz, then that means I'm going to, fail this class. I'm not going to graduate college. I'm going to be, living in a bot, like all these things where something very small kind of snowballs into something much bigger and much more serious. And when we're able to kind of catch that of I don't like that I failed this quiz, but that doesn't mean that I'm never going to get a job in the future. Emotional reasoning and labeling. So this is when we recognize what our emotions are and then use that as putting a label on ourselves. So if I feel like I embarrassed myself in front of some people, well, then I must be an idiot. I feel so embarrassed, so it must be true that I've done something terrible. I must be an idiot. And that kind of hurts. We can notice what our emotions are, and that doesn't mean that's who we are as a person. This next one, shoulding on yourself. This is another kind of favorite that I like to talk with students about, because often I hear, well, I should have done this, I should do that, or I need to do better, I must do this. And when there's a lot of critical language, self-critical language that people use. And so we like to say, we hear a lot of shoulds, or you're shoulding on yourself. So feeling that really blame. If I should have done something and I didn't do it, then that means I must be bad, or I must feel guilty. And often that doesn't necessarily help motivation to change behavior. And so when we recognize those should, or recognize that critical language, we can take steps to kind of manage that. And then personalization of, if you meet somebody and feel like you say something awkward. I also think the word awkward is when people say, oh, I'm so awkward. What does that even mean? What does awkward mean? Who gets to define what that is? But often people say, well, it's my fault that this interaction went poorly, or it's my fault. And when we take all that blame on ourselves, it can feel really hurtful and feel really critical. And then we get to that blaming language. And often all of these unhelpful thinking patterns often can manifest in that avoidance of, well, I'm not going to go hang out with friends, I'm not going to try. And then we feel further isolated and distanced. So those are some of the main unhelpful thinking patterns that we see. And again, by noticing what our mind is doing and the thoughts that are coming up, sometimes when we can put a label to those thoughts, it can be really helpful in managing them and noticing, oh, okay, my mind is, I'm shoulding on myself right now. Okay, I don't really like that. What can I do next? And in these next sections, we'll talk about how to manage that once we recognize that our mind is kind of taking us on an unhelpful path. So there's a lot of ways we can challenge unhelpful thoughts. So this is just countering those assumptions and distortions, and identifying other possible explanations. So there's some helpful questions we can ask ourselves. If I'm having a thought that, nobody likes me, or I'm going to do terrible, are there other ways I can think about this situation? Are there other ways I can think about myself? What would a friend say in this situation? Often we're so hard on ourselves, and we talk to ourselves in a way that we would never talk to a friend. And so thinking, what would I say to a friend in this situation? What would a friend say to me? And then what evidence do I have to support this thought or belief? So if we're feeling like we're struggling with academics and, oh my gosh, I got a C on this quiz, okay, well, how much did I study? What's the, overall grade of the class? Am I in that average area? How have I done before? And often we'll see that our minds often take us to the worst case scenario, which we'll get to in just a minute. And it's hard to see the opposite side of that, or it's hard to see where we have done well in the past. Then also asking ourselves, am I holding myself up to an unreasonable or double standard? Often see people maybe thinking, oh, I have to get A's on everything. I have to get 100. And that's really hard. And I think, we can hold ourselves up to a standard and we can have expectations, but recognizing and managing what are those expectations? Are they reasonable? Are they realistic? Am I putting those steps in to help me reach those goals or those expectations? And having a really honest conversation with ourselves about what that looks like. And then this is one of my favorites. Is this thought helpful? Is this helping me towards my goal? Is this helping me move forward in my values? And often, if that thought is giving us a little bit of concern, often that it's no. And if the thought isn't helpful, all right, what else can we do to manage it? What other ways can we think about it? How else can we deal with it? And so kind of taking note of some of these questions you can ask yourself and recognizing that, yeah, it takes a little bit of extra time, maybe an extra step to, one, recognize that we're having these unhelpful thoughts, two, to think about it in a different way, and then three, to kind of move forward with that new perspective. And so giving yourself time to make those changes and to take a breath. And we'll talk about breathing, just like we talked about in the first one, but giving ourselves time to make these changes and to create this awareness. So here we're going to do an exercise. So you can pause the tape here, get a piece of paper, a pencil, something to write things down with, and we'll walk through this exercise. So for this first step, we'll describe a common situation that triggers anxiety. So kind of thinking back to that first session, what situations often create anxiety, how different areas, situations, just kind of thinking of a common situation that triggers anxiety. So taking a moment, you can pause that if you need a little bit more time. And then the second step of this is imagining within that situation. So you got the situation, now imagine that situation and come up with 3 different outcomes. So one, worst case scenario. Worst case outcome, what's that? My mind immediately goes to this. Then, once you're done with that, I want you to think about the best case scenario. And so with this, I want you to think of literally the best thing that could happen. So it can just as maybe outrageous as the worst case, the best case. So Oprah finds my story. I get to go to Oprah's day of giving and she gives me $10 million. So best case scenario to match that worst case. And then for that third part, our third section, think about what's the likely outcome. What's most likely going to happen? And noticing how they differ. What do you see? What was maybe easy to come up with? What was a little bit more difficult? And then once you've got all those, imagining the worst case scenario comes true. So I know that can feel a little uncomfortable, but kind of stick with me here for a minute. So imagine the worst case scenario comes true. Would that still matter in a week? Would that still matter in a month? Would it still matter in a year? And I want to take a moment now to recognize that, we're in this state of pandemic, that this can be a really tough time for dealing with anxiety because some things are a little bit more uncertain. And recognizing that outside of the pandemic, we're still experiencing stressors from day-to-day life. So whether it's academics, whether it's relationships, and feeling anxious about the pandemic as a whole is normal, it's acceptable. And feeling anxious about the general day-to-day things is also acceptable and also is really normal right now. And so as we're going through this example, kind of seeing where are those anxious thoughts coming from, and where is that coming from, and maybe it feels different now than it would have before, and that's okay. And just noticing what comes up for you during this exercise, and noticing kind of how you're moving through this. And in the following exercises, we'll talk about other ways if this exercise isn't helpful. And so then for the fourth step, using your worst outcome and likely outcome and describing what maybe those unhelpful thoughts are that brought you to your worst case scenario. And then maybe what are some other helpful or maybe rational thoughts that can help get to that likely outcome. And so again, this is, we're not beating ourselves up for having those unhelpful thoughts. We're not trying necessarily to change those thoughts, but we're providing other perspectives or other thoughts that can help us in this situation. And so again, if that really worked for you, awesome. If not, we've got some other exercises we can do as well. And so we also have what's called, at our disposal, cognitive diffusion. And so this is just a really kind of jargony term for getting untangled with our thoughts. And cognitive diffusion can be especially helpful for thoughts that maybe feel more like ruminative, or that they feel more stuck, or that it's hard to find that evidence for, evidence against, or more depressive thoughts, or those thoughts that just feel more sticky and they feel more close to ourselves. And so cognitive diffusion, this is just some really helpful ways to get some space between those thoughts. Often those thoughts maybe feel like they're right in front of our face. We can't stop thinking about them. And by practicing some cognitive diffusion and some of these different steps, we can create some space so we can notice our thoughts, we can see how they're impacting us, and we can allow them to be and move forward. And so some helpful things that we can do that we've kind of talked about before too, and it's just how do we incorporate it right now. So one, maybe can feel kind of silly, but thanking your mind, right? Our mind often gives us things to think about. It's always going. And so sometimes just thanking our mind, and sometimes we'll kind of make a joke of it, say like, thanks brain, when it comes up with an unhelpful thought of, thanks brain, I know that you're trying to help me right now. You think this is going to keep me safe, and this isn't super helpful right now. So we can kind of thank our mind and then redirect our focus. So I'm noticing that my mind's wandering, that it's giving me an unhelpful thought. What's important to focus on right now? Whether that's a conversation with a friend, or taking a breath, or doing homework. What is it that's an important thing to gently redirect my focus onto? Then becoming an observer of your thoughts and an observer of what's going on. So in that first session, we talked about that non-judgmental awareness. And so kind of, again, creating that non-judgmental stance of, okay, what is my mind thinking? What am I noticing here? And then just naming things that you notice. So, okay, I just had an all or none thought there, or I'm really catastrophizing, or, oh man, like I'm shutting on myself really hard right now. And so again, by naming it, we can feel like we have more power over it. And then noticing when you're judging, am I really being very critical of myself right now? Is this something that I would tell a friend? How might a friend respond to me in this situation? And then coming back to the present, as we talked about with mindfulness, we're reconnecting with the present moment to notice where our mind's going, what's important at this current time. And so coming back to the present, whether it's taking a breath, whether it's practicing some grounding techniques that we'll do in a minute, but noticing kind of from start to finish, noticing when our mind is wandering, redirecting focus, naming it, coming back to what is it that's going to be important right now. And so you can pause here and kind of practice this for yourself of thanks brain to coming back to the present. And so we mentioned this before, but grounding techniques. So grounding is a really helpful way to bring us back to the present moment. And there's a lot of different techniques for grounding, but it essentially can incorporate all our different senses. And so one of my favorite ones is a 5-4-3-2-1 grounding technique. And you can see the kind of essentially the steps right here, where we practice focusing on our breathing. So let's try it right now as you're watching this tape. So take a moment and just start by noticing your breath. Just knowing that at this moment, there's nothing else you need to be doing, nowhere else you have to be. You're exactly where you're supposed to be. Just notice that rise and fall of your chest, your abdomen. And then taking a moment and noticing 5 things that you can see. Just kind of looking around the room. And in your mind, or you can name them out loud, 5 things that you can see. And once you've done that, kind of feel around where you are and 4 things that you can touch. And kind of notice for yourself, what are those sensations? Is it hard? Is it soft? Is it cool? Is it warm? Maybe it's you can feel the chair on your back. Noticing 4 things that you can touch. And maybe notice now 3 things that you can hear. And taking some silence. And then noticing 2 things that you can smell. If you have allergies, it might be a little bit more difficult, but doing your best. And then 1 thing that you can taste. And then come back to noticing your breath. And kind of thinking for yourself, what was that? How did I feel in that moment? What was that like? And you can use this at any time when you notice that those anxious thoughts, those unhelpful thoughts are kind of swirling around, and it's hard to focus on something. Okay, let me ground myself, and I can manage what's going on. So feel free to try this whenever. And then another really helpful exercise is what's called progressive muscle relaxation. And so this is helping us to create awareness of where maybe we feel that anxiety in our body, where we feel that tension. And essentially it's a process of tensing and relaxing isolated muscle groups with a goal of kind of overall lowering tension levels. And so we won't go through a full exercise, but there are some great apps and great videos on YouTube that you can look at and Google. And if you want a script for that, feel free to reach out to us, and we can send out some resources. But essentially what you do, so you can practice it right now real quick here. So you can take your hand, and when I say tense, just squeeze your hand as hard as you can. And then as soon as I say relax, you're going to release, and really noticing that tension versus relaxation. So take your hand, create a fist, and tense really hard. Squeeze, squeeze, squeeze as hard as you can, noticing that feeling of discomfort, that feeling of tension. And now relax. So immediately releasing and noticing a sense of warmth, feeling light or feeling heavy, just kind of noticing what that tension, and essentially doing that throughout your whole body to help with that relaxation. This can be really helpful too before bed, to help calm your mind down. But this can be a really great technique as well. So that kind of brings us to the end of our session. So kind of some take-home points. So remember, recognizing unhelpful thinking styles can help us manage them more when they arise. And as we've learned today, and through that first session, there are a lot of ways we can manage our thoughts. Challenging unhelpful thoughts can provide us with a different perspective of viewing our thoughts. But then mindfulness and cognitive diffusion can be other ways to manage these unhelpful thoughts when they feel more difficult to challenge, or it's harder to challenge them. And then grounding and progressive muscle relaxation can bring us back to the present to better recognize and be aware of our thoughts and feelings. And so if you do have any questions, feel free to reach out to us at the Counseling Center. More than happy to talk to you about any of these techniques or how this can be applied to your life. Next for the next session, session 3, we really talk about changing the cycle of anxiety and applying the skills. And so being on the lookout for that, or listening to that next year, or joining us live, whatever manner works best for you. But I really appreciate your time and attention, and I'm very hopeful that this was helpful for you, and just providing different perspectives and maybe adding some tools to your coping skills toolbox. So again, thank you so much, and have a great rest of your day.